Welcome back. David Hertel in for Elias. Well, I don't think it's news to anyone out there that our healthcare system is in deep, deep, deep trouble, and for many, many, many years. So what's the solution? Interesting study from the Montreal Economic Institute now calling for reforms that go beyond just throwing money at the system. To tell us more, I'm joined by Emmanuelle Faubert, who authored the study for the Montreal Economic Institute and is their healthcare expert. Emmanuelle, thank you for joining us today.
My pleasure.
So, I just want to quote from the piece in the Gazette where you say, for too long we've tried to fix an organizational problem by throwing more and more money at it. It's time for Quebec to change tack and let independent clinics and hospitals improve Quebecers' access to care. Very interesting. So basically what you're saying is we should go full throttle towards privatization?
What I'm talking about is we need to look at a different way to do things because for decades we've been increasing budgets, throwing more money at the healthcare system. And as we can see, it is not improving. It's actually deteriorating. So what we need to do is we need to think outside the box, look at what is being done elsewhere around the world, mainly looking at what European countries are doing, and see what we take the good things that they are doing and see what we can implement here, and having the healthcare institutions having more autonomy in how they operate in their day-to-day is a good way to go.
So give me some concrete examples. What are those solutions that are working elsewhere that could be implemented here?
For example, you have activity-based funding, which is something that is commonly used elsewhere around the world. However, in Canada, most hospitals are funded through global budget. What that means is that budgets are based on the financial needs of previous years, and what happens during the current year is not taken into account in the budget. So what that means is for every patient that goes through the doors, it is an additional restraint, an additional cost for the hospitals. When you have what we call activity-based funding, which is financing the hospitals based on medical services rendered, each patient that comes through the door becomes a source of revenue, which encourages hospitals to have more gains of efficiency to see more patients.
Okay, so if I understand correctly, the funding would be tied to some sort of performance-based result.
Performance-based, the number of people that are being seen. Another way to see it is funding that follows the patient. So this also encourages competition between points of services, because good service, quality service, and efficient service will be rewarded. And if you're not providing services, you won't get funded. So it encourages more efficiency, more care given to the patients.
So is that your key point, or do you have other solutions?
There's many other solutions.
No.
For example, what Quebec has been doing, increasing the powers of nurse practitioners. Since April, nurse practitioners can now take charge of patients that are waiting for a family doctor. That is a great thing because nurse practitioners have the training, have the capacity, have the knowledge. Also, something that is done in Alberta is pharmacist clinics, where pharmacists take a bigger role in terms of prescription renewals, considering that around 10% of ER visits are due to prescription problems. That is also helping. And with the new Bill 69, Quebec is going towards that direction. That is a good thing as well.
In your piece, you mentioned that in France, for example, and I'm quoting here, nearly 1 in 3 hospitals is run by independent entrepreneurs. In the United Kingdom, which serves as the inspiration for our health system, it's nearly 40% of hospitals. In the Netherlands, all hospitals are independent. So are you advocating also for a major role for the private sector here?
I'm going for autonomy of hospitals, because we know that the bureaucratic machine is very heavy, very complicated. Things move very slowly. So when you have more independence of how you operate your hospital, your clinic, you are able to innovate more, to gain efficiency, something that you cannot do when you have all the paperwork, all the bureaucracy. You're tied down by all these bureaucratic rules that slow you down immensely. It's more autonomy for hospitals and clinics.
So how would that work? I mean, you're an economist. You know our healthcare system. I mean, what you're proposing, I find it very interesting. And it's great to look at what works elsewhere, because there are solutions to healthcare that exist elsewhere that we're not implementing here. So how do you think we could implement some of these recommendations you're proposing?
Well, it's going to be complicated because there's many things that are different between European systems and what we have, and there won't be one magical solution for sure. But looking into releasing control, for example, when it comes to furnishing, hospitals right now have to go through one single process that is managed by the state, and they say if you want new scrubs, if you want new towels, if you want new bed sheets, you need to go through this government-approved,
No, you have to go through like Quebec City, and you got to go through the heavy bureaucracy to order paper clips. Yeah,
for paper clips, for anything. These are things that slow down and are very, very cumbersome and sometimes more expensive than what people could find on their own. It's tiny things like that overall really impedes the process of day-to-day operations.
Do you really think the new agency that was set up by the Legault government, Santé Québec, could go down that road?
Not really.
No, I don't see it either.
Because it's even more centralized, because you have one body that will control everything. But let's be real, the needs in Gaspésie, of a clinic in Gaspésie, are not the same as the need of a hospital in downtown Montreal. They are not the same. The employees do not require the same needs, the same compensations. They are not the same. So you cannot treat everybody the same.
So you studied these decentralized models for hospitals in France, in the United Kingdom, in the Netherlands. I mean, 3 countries where you would think, that it's all centralized, all government controlled. So what was do you know what the secret sauce was? What was the move that allowed these otherwise, very renowned centralized government-controlled countries to let the door open for private hospitals to play a major role?
It's really there's many things. The big thing is just autonomy of what hospitals want to do.
Just give the power to the hospitals.
Exactly, because right now the public hospitals that we have in Canada are very, very dependent on the state, and they cannot go outside of what the government wants. Otherwise, they won't have funding. Things like that. They need autonomy, and that's a very big thing.
So you think with autonomy, we would actually save money and give better care? There would be access would be improved.
Because if there's autonomy of operation on a day-to-day basis, there is place for innovation. And if there's innovation being made, then after that, if we find new solutions, then we can apply them to the rest of the hospitals. But if managers and people on the field do not even have the ability and are stuck with all the bureaucratic problems, if they cannot move forward with attempting new innovations, we won't have improvements.
Emmanuelle Faubert, thank you very much for your time. This is very interesting. Appreciate it.
Thank you for having me.
Emmanuelle Faubert is the author of this study for the Montreal Economic Institute. She's an economist, and she is the healthcare expert for the MEI. This is very interesting stuff, because I think, when we're talking about also the rise of conservatism, I think in a lot of ways, the left and the omnipresence of government and the state has hit a wall. It is not performing anymore. And so there has to be a swing of the pendulum in certain areas. And here in the healthcare system, we're going to have to try these solutions that are proposed by more conservative-leaning think tanks that are basing themselves on what's going on in traditional centralized states like the UK, like France, like the Netherlands. And they've gone down the private sector. They've gone down to competition. They've gone down to letting hospitals make decisions and let go of the massive state system. So hopefully somebody somewhere, especially at Santé Québec and the top guns over there, are going to listen. because we need to try something different. Because as Emmanuelle Faubert writes, and others have said, throwing money at the system no longer works.